Let's go through the DSM-5 for schizophrenia. Schizophrenia includes experiencing 2 or more of the following symptoms for a significant period of time during a 1-month period. There needs to be continuous signs of disturbances for at least 6 months while the person is experiencing the following symptoms: delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, and negative symptoms such as a flat affect, reduced ability to produce language. Disturbance needs to impact the person negatively in more than one area of their life, such as work, school, parenting, relationships, or self-care. This is noticed by a significant diminishment in a person's ability to maintain the routines of their life at school or at work, and a marked disturbance in someone's ability to care for themselves. There needs to be continuous signs of disturbances for at least 6 months. And if there is a reduction in the presentation of symptoms, like if somebody is experiencing less outward signs of psychosis, like delusions or hallucinations or false beliefs, exaggerated beliefs, they can still be observed experiencing negative symptoms, decreased speech, inability to express themselves, low emotional range, poor relationships, low self-care, withdrawing from others. If a person is experiencing periods of depression and mania, as well as times where their symptoms of psychosis are changing in frequency or severity, they may be more appropriate for schizoaffective disorder. Schizophrenia includes a lack of variation in symptoms of psychosis and a high severity when you're looking at those disturbances at work or school, or looking at someone's inability to take care of themselves or keep themselves safe or interact with others. The symptoms of psychosis or the negative symptoms of schizophrenia cannot be due to a physical condition or someone's use of substances. Some people talk about the link between drugs and schizophrenia, but when we're talking about schizophrenia, we're looking at symptoms of psychosis impacting a person's ability to care for themselves and interact in the environment, as well as negative symptoms that impact a person's ability to express themselves, speak, and communicate. If there is a history of autism spectrum disorder or communication disorder of childhood onset, the additional diagnosis of schizophrenia should only be made if there is a new presence of hallucinations or delusions. The behavior between schizophrenia and autism has overlap. The diagnosis of schizophrenia is important if someone is experiencing negative symptoms plus delusions, hallucinations, bizarre behavior. The specifiers now, these are only to be used if the disorder has been present for over a year. First episode, currently an acute episode. This is the first episode of the disorder, and they're currently in the episode presenting with psychotic features. First episode, currently in partial remission. They're experiencing their first episode, their psychotic break, and they're currently experiencing a period of remission, during which an improvement after a previous episode is maintained. First episode in full remission. Full remission is a period of time after a previous episode during which no disorder-specific symptoms are present. This is not something that I personally have seen in my work. Full episodes, currently an acute episode. Somebody's had multiple episodes of lucidity, clarity, psychosis, disconnection, disorganization, and they're currently in the episode. Additionally, we have somebody who's had multiple episodes that's currently in partial remission, or someone who has had previous episodes that's currently in full remission. There's also the continuous, where the symptoms are present during the majority of the illness course, and there is very little relief. And the last specifier is unspecified. I've seen this many times. Catatonia can also be a specifier if someone is experiencing rigidity, uncontrolled movements, disconnection between their nerves and their body, delayed reactions, delayed behaviors. Those are symptoms of catatonia. And you can also specify the severity. Severity is rated by an assessment of the primary symptoms of psychosis, including delusions, hallucinations, disorganized speech, abnormal psychomotor behavior, and negative symptoms. Each of these symptoms may be rated for its current severity, looking at the most severe presentation in the last 7 days. On a 5-point scale, the diagnosis of schizophrenia can be made without this severity scale.